Well, the World Health Organization has declared Sierra Leone free of the Ebola virus. 42 days have passed since the last Ebola patient was discharged. That's twice the maximum incubation period. And the WHO says Sierra Leone now enters a 90-day period of enhanced surveillance to monitor any new cases of the virus. More than 14,000 cases of Ebola have been reported in Sierra Leone. Nearly 4,000 people have died. Guinea is now the only country reporting new cases, but there are fears of a resurgence. TRT World's Fidelis Mba joins us now for more on that story. Fidelis, is this actually reason to celebrate, or would that be premature considering that Guinea is right next door and has still not been declared Ebola-free?
Well, momentarily, they have a reason to celebrate for the fact that they've stayed 42 days and been declared Ebola-free, because now their international isolation is over. They can travel in and out freely. People can invest. Things can pick up gradually. But again, there's a need for caution, because just next door, Guinea, there are new cases in Guinea. And, the borders are very porous. Yeah. Not just... The screening is actually very tight for those who are flying into the country, but those using the land borders is not that tough. So this is something that they really have to work on. So
what kind of investment and maintenance is needed then in Sierra Leone to prevent any risk of another outbreak?
They have to strengthen healthcare facilities, especially in rural areas, because most of these investments are in cities, major cities like Freetown. And these rural areas, they lack basic amenity healthcare facilities. And it goes beyond using hand sanitizers or other just basic medical facilities. So if they do this, and then they strengthen the borders, especially the land borders, where a large number of people are actually coming to the country, in terms of screening people who come in and those who go out, I think they will be able to be on the path of clearly eliminating Ebola from the country.
How confident should we be that that will happen?
Well, the president has promised that they're going to strengthen, more like step-up screening at the border points. And the WHO has also promised to be with them for these 90 days from between now and February, so that they will be able to more like assist them with expertise, medical consultants, getting also funds, the needed funds and facilities to be able, for them to be able to meet up with the deadline. And also from there going forward, they will be able to have more like a culture that will help them in preventing a future occurrence.
Okay, Fidelis, we'll leave it there. Thanks so much for joining us. Well, on to